On behalf of the PRO campaign, ColoradoCare, we have Senator Irene Aguilar. And then on behalf of the NO campaign, Colorado's for Coloradans, we have the South Lake. So I'll ask all of them to join us up front, and we'll get started.
Good morning, and Adela, thank you for the introduction. My name is Michelle Leek. I'm the president of the Colorado Health Institute, and I am serving in the moderator role today. I feel like we're definitely in an election year because it seems so formal up here for a state that has always sort of prides itself by collaboration. You have Cody Belsley on the right and Senator Aguilar on the left, or other way around, or however that works. So before I do that, Adela asked me to share with you some of the major principles of ColoradoCare, and that's really generated off from a report that you have in front of you. It's an independent analysis that we published last month. It's the first in a series of reports that we're planning to publish over the course of the summer on ColoradoCare. And this report really is definitional and descriptive in tone and nature. And so I wanted to share with you just a couple of broad brushstrokes and sort of put us all on the same playing field, if you will, in terms of what it is that we're all here talking about today. That'll take me about 5 minutes, then we have some prepared questions and hopefully prepared remarks from our two speakers. And then we were going to open it up to all of you. So that's a very long way of saying get your note cards ready and hand them in. This is the time to answer your questions. So I'm going to share with you, I think, 5 important things about ColoradoCare, and that will put you in the ballpark. My guess is that you're already in the ballpark because you're sitting in this room today, but just in terms of level setting, here I go. First, ColoradoCare envisions a new health insurance system that would ensure that all Coloradans have coverage. And this coverage is insured to people regardless of how long you've lived in the state, your citizenship, or your documentation status. So that's important to know. Medicare and other programs, federal programs like TRICARE or other veterans programs would still be in existence, so it's not a single payer system, but it is a universal health system. And it will be possible to have other kinds of health insurance, but ColoradoCare in most cases would be your primary health insurance. The second point I'd like to make is that ColoradoCare promises to provide very comprehensive care. And that would cover benefits like doctor's visits, hospital care, lab work, prescription drugs. It's detailed in the amendment itself. Proponents will share with you exactly what that means, but it's at 96% of what's called anticipated or actuarial medical care costs. You can contrast that to the exchange, where most people on the exchange have bought bronze plans when they buy plans on the exchange, which covers about 60% of cost. So in theory, it's a very comprehensive, very robust set of benefits that would be provided under ColoradoCare. Which leads me to the third point. You might be wondering how this is financed and how this is paid for. And certainly most of us, I think, in this room know that. It will come through a payroll tax, a 10% payroll tax. The initial cost of that tax, or the size of that tax, will be $25 billion. Senator Aguilar and Cody Belsley will certainly weigh in on this. But there are provisions for if there's a funding shortfall, how that's managed, and so forth. And then finally, my fourth point is that from our reading, CCHI's analysis, whether or not this $25 billion plus additional fees the cost of ColoradoCare, whether or not this saves money or costs us money, is still unknown at this point. Cody and Senator Aguilar will have different points of view on that, but we are trying to look under the hood, and that's a financial analysis that will be available from CCHI in the July timeframe. And finally, just in terms of broad brushstrokes, I want to share that there will be a new member-elected governing board that will make lots of decisions for ColoradoCare here in Colorado. So the governance, I think, is a point of interest, I think, for many of us in the room, and I look forward to exploring that in some detail. So we've done a few of these over the course of the past few months, and my impression is that we get pretty tactical pretty quickly. So the first set of questions are really about the theoretical underpinnings of ColoradoCare. Why did we get here? What's the problems that we're trying to solve? And so my first question to you, Senator Aguilar, is what is the problem or set of problems that ColoradoCare is solving?
Thank you, Michelle, and I want to thank the Colorado Health Institute for their work on this. They're doing a great job trying to be non-biased, and they're kind enough to let me know what they're working on and make sure I feel like it's fair. I also want to thank the Colorado Consumer Health Initiative for putting on this forum. I want to thank everyone in this room because I recognize a lot of your faces, and I know that you actually are very involved in healthcare reform and access to healthcare. And so I geared my remarks to that type of an audience. And finally, I need to thank Cody Belsley for coming here. Usually we go, when I do a pro-opposite debate, I'm actually with people who mostly support the opposites. It's sort of nice to be here with people who actually really support access to healthcare for people. So, the first question they gave me, and I pondered on what are the exact points I should talk about with this, is what problem or problems is ColoradoCare intended to solve? And I can never answer that without doing a little bit of background. And what I want to remind you is that in 2014, the United States healthcare spending reached $3 trillion, an average of $9,523 per person. Yet we are the only developed country that does not guarantee access to basic health care for all of our population. Our working middle-class families are forced to choose between health insurance and other basic family needs. And Coloradans with insurance continue to experience medical bankruptcy even after the Affordable Care Act. I personally think this is unacceptable and that it's shameful. A 2012 Kaiser Family Foundation analysis of our medical expenditure panel survey found that 20% of our population accounts for 82% of healthcare spending, while 50% of us spend under 3% of our total healthcare spend. So I want you to think about what happens when this 20% of our population who really needs medical care can't access the care that they need. They go to the emergency room. They end up in the hospital. They have increased risk to themselves. This is their ultimate skin in the game. They have a risk of preventable complications and long-term disabilities. And most importantly, their increased healthcare costs go to the premiums of the people who are healthy, because they will get the care that they need, and the costs will be spread amongst people who are well insured. Or the worst thing is that they could die prematurely, and we have evidence that we lose over 300 Coloradans a year who don't access health care in a timely fashion. At this same time, the medical industrial complex is seeing unfathomable increases in profits. We are the 99%, and the healthcare industry is the 1%. Many of the highest earners among organizations in Standard & Poor's 500 Index are healthcare and pharmaceutical company CEOs. Alan Baumgartner's report showed that Health One had a 32.7% profit margin. That's $626 million in 2014, Health One in Colorado alone. And the university had a 22% operating margin. Together, those are $1 billion in profit in those two health system organizations. And right now, the medical industrial complex is using our healthcare dollar to protect their profits and prevent Amendment 69 from passing. Coloradans has raised over $3 million in the last 6 months. They've received $1 million from Anthem alone. United, Cigna, Delta Dental, and Kaiser are major donors. The not-for-profit-based SCL healthcare system has donated $100,000 to defeat ColoradoCare. And other hospitals, even including Children's, Centura, and Health One, are major donors. Pharma, DaVita, the Lockton Company, and many other people who feed at the healthcare industry teat are investing hundreds of thousands of dollars to defeat Colorado Amendment 69 because they know that they profit from our distress. And they are very smart at playing games to maximize their profits. Even with the Affordable Care Act, they have found ways to make money. Do we really need more hospitals in the Front Range? Do we really need more freestanding emergency rooms that can cost more than 10 times the price of urgent care? Is it reasonable to charge $80,000 to $120,000 for a 3-month course of treatment for hepatitis C? I say no. ColoradoCare allows us to put all of our healthcare dollars into a nonprofit Colorado Healthcare Trust Fund managed by a board of trustees that we elect to represent our interests. We are the shareholders, people, not profits. We can be sure everyone pays in, but we need to make this according to their means. People are not buying insurance because they don't want to, they're not buying it because they can't afford it, and that everyone is fully covered. We can truly eliminate medical bankruptcy. We can simplify administration and save patients hours of anxiety and time and distress trying to get their medical bills paid, trying to access the treatment that they need. And we can also decrease our medical providers' burnout, which is at an all-time high. We can pay good salaries for frontline providers and give competitive reimbursements to hospitals. A hospital CEO told me they need a 4% profit margin to keep up with bill rates in medicine and keep their hospital up to date, not 33%. We can prioritize caring for our most complex, costly patients who are often turned away at the door because they have Medicare, they have Medicaid, and their insurance does not pay what a United pays or what a Cigna pays. And we will save money. And I think for those reasons, this is the time, ColoradoCare.
Great, thank you, Senator. Cody. Hi, everyone.
Good morning. Senator Aguilar, I too see many familiar and friendly faces in the audience, and I'm very glad to be here. Thank you very much to Adela and Deb and the CCHI team. Thanks to CCHI for the great work they're doing. And I just want to, Senator Aguilar was kind enough to make warm remarks at the beginning. I want to echo them. More often than not, over the course of the last 12 years, we've been working together on policies to improve access to care, and I want to start by just thanking her for her tireless leadership in healthcare in this state. I want to say at the outset that I agree with a lot of the challenges that Senator Aguilar just outlined. Oh, microphone's better, okay. I agree that our healthcare system doesn't work as well or as well as it could or it should. I've dedicated the last 15 years of my professional life to expanding access to healthcare services, particularly for low-income and vulnerable populations. I sincerely, in a heartfelt way, applaud the good intentions behind Amendment 69, and I share the goal of reaching universal coverage. Healthcare is far from perfect in Colorado, but there are encouraging signs of progress. Today, more than 93% of Coloradans have health insurance. That's up from 84% in 2011. Thanks to the ACA, we've ensured that more comprehensive health benefits in the private market, eliminating exclusions for pre-existing conditions, and ensuring full coverage of preventive services. Through the state innovation model and other promising initiatives, we're seeing meaningful progress towards payment and delivery system reforms that will lead to more efficient and effective care delivery. This progress is incremental, it's slow, at times it can be frustrating and painful, but to move forward on this path, we need persistence and patience. Thanks to CCHI and many of you, we're seeing that progress. And we shouldn't abandon the reform that's working in favor of a risky, uncertain, and unaffordable proposal. A state-level government-run healthcare system won't solve the problems that Senator Aguilar has outlined and which I have stipulated are significant challenges in our healthcare system. The reality is Colorado can't go it alone. The American healthcare system is a national system. States certainly have a role to play in that system, but they're just one player in a very large and complex public-private system. It's difficult, if not impossible, to detangle healthcare at the state level. We know that that's true because in this proposal alone, we're not reaching a single-payer structure. We'll maintain Medicare, we'll maintain TRICARE. Visitors, tourists who come to Colorado and seek healthcare services will bring with them their private coverage, meaning that hospitals and physicians who treat those out-of-town patients will need to maintain the billing systems in place to serve them. Therefore, the potential efficiencies of a single-payer system that could be potentially achieved at the national level aren't reasonable or possible at the state level. We know this not just from our research and analysis of Amendment 69 and talking to providers and communities. We know this because of the experience of Vermont, a state that invested years and hundreds of thousands of dollars in investigating the viability of a state-level system. The Democratic governor of Vermont, who ran for election on a platform of bringing single-payer health care to Vermont, was the one who ultimately pulled the plug on that proposal, saying that the risk of economic shock to the state was just too great to pursue. Colorado doesn't need to pursue this path in order to come to that conclusion. We also know that while the proponents of Amendment 69 have laid out their vision for what this system could look like, the devil is in the details. And those details will be largely determined by a 21-member elected board. The qualifications for serving on that board are that you are 18 years of age or older and that you live in the district you seek to represent. There is no requirement for knowledge or expertise or understanding of healthcare delivery, financing. There's also no guarantee of political diversity or balance on that board. Those boards will be, as I said, publicly elected, and when you look at what local elections have come to in Colorado, for example, recent school board elections in the metro area, you can only imagine how politicized those campaigns for those seats may become and how challenging it may be for that board to function appropriately in making really critical decisions about the healthcare benefits that are provided to Coloradans, the payments provided to hospitals and providers, and the costs, the taxes associated with running the proposal. I also just want to, I guess, close here because we have a lot of other questions still to come, by just noting that as is indicated in the name, this is a constitutional amendment. We would be locking into the Constitution this very complex, new, and untested healthcare system, making it very difficult to alter in the future. Certainly, I know many of you, like me, are policy wonks, policy geeks. You've spent a lot of time looking at and thinking about Tabor, Gallagher, Amendment 23, the interplay of those initiatives. Regardless of what you think of the substance of those policies, I think most people agree that locking complex and large policies into the state constitution has created challenges for our government in terms of how we budget and how we administer our programs. And so locking another large and complex issue into our state's constitution is significantly problematic.
Great, Cody, thank you. And I'm going to stick with you for just a minute. You've laid out some challenges, but imagine, as much as you probably don't want to, that the passage of ColoradoCare. And what do you foresee as both intended and unintended consequences of the passage?
So I appreciate the question. I'm just going to say at the beginning that I really can't speak to the intentions of the proponents. No one reached out to me in the drafting of Amendment 69, and so I'm not going to try to guess what they had intended to do or not to do. I think the first thing, and I touched on this a minute ago, but I want to come back to it. Amendment 69 empowers a 21-member elected board of trustees with wide-ranging authority to set benefits and cost-sharing policies, to set the reimbursement rates, to address future tax increases to support this initiative. Because they are empowered to make such critically important decisions and to figure out all of the details, it's really hard to foresee how Amendment 69 is going to be implemented. And it's difficult to predict what the consequences might be. I will say, and just come back to this point, that that in and of itself for me is a concern, right? The potential politicization of the elections for these positions is deeply concerning and something to highlight. Another unknown is the viability of the federal waiver necessary to make ColoradoCare a reality. The entire proposal hinges on federal approval of a significant waiver to take control of the Medicaid program and other federal funds. The Colorado Health Institute, in their independent analysis, estimates that that total number is about $13 billion. So you take the $25 billion new tax revenue, you add the $13 billion of existing state and federal revenue that ColoradoCare will take control of, and the actual operating revenue for this entity will be about $38 billion. To give you context, the state budget that was just approved, I think, came in, Senator, at about $27 billion. And CCHI's analysis compares the size of this new entity with well-known global corporations like 3M, Nike, McDonald's. So it's a really large and significant entity. But let me get back to the waiver. The proposal doesn't fly, the financing doesn't work, absent the federal funding coming through. It's unclear that either Trump or Clinton administration would even entertain such a negotiation. And if they did, it's difficult to know how many years it would take to negotiate such an amendment or such a waiver, and what would happen during that time. What's interesting is that the proponents have envisioned a transition period in which taxpayer revenue would be collected in order to help with the establishment of this new entity. Now, I want to be really clear, it's a much lower tax rate than what is ultimately envisioned. But nonetheless, taxpayer dollars are being collected to help fund the negotiation with the federal government over this waiver and to help fund the establishment of this massive new bureaucracy necessary to implement this new system. Colorado taxpayers receive no health care benefits during this interim period. In fact, Colorado taxpayers will both be paying the tax and be paying for their private health insurance benefits during this period. And it's unclear how long this period will take. Proponents have envisioned that the setup time period could be 3 years, but there's no limit to that. It could continue indefinitely. If the waiver is ultimately approved, we have no way of knowing today what the details of that waiver will be and what that will mean for the administration of the Medicaid program, what it will mean for payments to hospitals and providers, what it will mean in terms of benefits. So that's a consequence, an unknown that I think makes it difficult to predict the consequences. Another unknown that makes it difficult to predict the consequences, the reality is that this is the first of its, this would be, if approved, the first of its kind state-level government-run healthcare system in the country. There is no model for us to look to build this new structure around. This whole new proposal is based on projections, assumptions, hopes. As I said, I think they're very good and reasonable and valid assumptions and hopes, but nonetheless, they are assumptions. Anyone who has launched a new business or even undertaken a new venture as simple as like a home renovation project will know that when you're budgeting for a new entity, you almost never get it right? You miss one way or another on those assumptions. The challenge is when you're building a $38 billion entity that will be responsible for providing healthcare benefits to nearly 5 million people, being off even by a little bit in your assumptions can have massive repercussions for the system moving forward. So what happens if the proponents are off in their assumptions? Well, basically the Board of Trustees is then empowered with 3 options. They can cut benefits. I want to be really clear about this point. The amendment language outlines 11 broad categories of coverage: hospitalization, outpatient care, mental health services, end-of-life care. But the amendment language provides no guarantee of what the specific levels of benefits will be within any of those categories. Those decisions are all left to be made by this 21-member board. And if the budget comes in a little off, if the board can't fulfill the promise that proponents have made during this campaign to provide a platinum level coverage package, the board would have the opportunity to reduce those benefit levels, leaving Coloradans either at risk for not getting the care or services they need, or leading to the development of a secondary or supplemental coverage market and requiring Coloradans to both pay the taxes and pay for that supplemental coverage. I want to note that this is not some sort of abstract risk, right? The idea of supplemental coverage, we see it in Medicare, we see it in many countries that have publicly financed healthcare systems. The public coverage becomes sort of the base model, and then people who can afford it buy wraparound additional coverage. Another potential consequence if the money doesn't come in the way proponents expect and the financial model doesn't work out is that the board could cut payments to providers. Again, there's no guarantee in the amendment language what providers will be paid. Proponents are, in their modeling, have outlined an assumption of being able to pay better than Medicare, somewhere between 100 and 150% of Medicare rates on average, but that's an envisioned hope. Certainly, if payments get cut to providers, that will directly impact access to care, because we know that coverage alone is not enough to ensure services. And then the third option that is left to the board is to raise taxes again. And here's a really important and interesting nuance in the amendment language. Future tax increases to be voted on are voted on by members of ColoradoCare. A member of ColoradoCare is a defined term in the language, and it is defined to be a person who has lived in the state for one continuous year or longer and is a beneficiary of the program. That definition of a member of ColoradoCare does not match the definition of who's eligible to vote in the state of Colorado. So that in addition to running the bureaucracy of the healthcare structure, ColoradoCare will also need to run a bureaucracy for implementing an elections process, a statewide elections process, in order to elect the future members of the Board of Trustees and to address any future tax increases.
So Cody, I'm going to ask for the senator's response, and in the interest of time, I think we'll move right to questions from the audience after that.
Thank you very much. First of all, I do want to thank Cody again, but I do want to also remind you that it is true that while our underinsurance rate or uninsured rate went from 14 to 7%, that according to the Colorado Health Institute, that represents about 400,000 more lives covered, and during that time we added $450,000 to Medicaid. So the large bulk of the decrease in our uninsured is from Medicaid expansion. And these are the same people who now have trouble finding specialty providers because Medicaid does not reimburse enough. During the last 4 years, the Colorado Health Institute showed that underinsurance went from 12.8% to 16.4%. And so as I feared, we have put a mandate on people to purchase a product that does not provide the coverage that they need if they're sick. I do want to also state that the issue about whether one state can go it alone or not, in Canada, when they implemented their single payer plan, it started with Saskatchewan. And doctors were on strike, people threatened to leave. It was so successful that over time, all the other provinces adopted it. I think, unfortunately, that politics will not let this happen at a national level. And the Colorado Health Institute, again, estimates that 82% of people are automatically covered by ColoradoCare. One of the things the Board of Directors is asked to do is to apply to become a Medicare Advantage plan, which would bring that number up to 90%. And we frequently deal with people who come from out of state, and that would continue to happen. And it is not outside of the realm of possibilities that the Board of Directors would reimburse all providers and get the Medicare reimbursement to ColoradoCare itself to funnel that, because some of our vision is that we get rid of our second and third class citizens who couldn't afford the best product on the market. It's interesting to me that we are a government-run health system, and yet we're not electing politicians to run it. And so it's a conflict in what I hear from the opposition. And unfortunately, the requirements to be on the Board of ColoradoCare are the same as the requirements for the people who serve you now in Congress and the U.S. Senate. The difference will be that the people will know they're electing people whose only area of focus is health care. And I think that gives you a better chance of getting a good representative government. The other thing that I want to say is that I do keep getting told, it doesn't say all the details. You can't guarantee me what's going to be paid. But there are small little words, and this is a constitutional amendment, and it's in the Constitution because I do not trust our state government not to overrun the will of the people and get rid of this, even if it's successful. And I don't trust them because I've worked in state government at the Capitol as a senator, And I know that the healthcare industry is the largest spender of money on lobbying in the state of Colorado. But anyway, it's in the Constitution to protect it. And just like with Amendment 64, once it's in the Constitution, the legislature will hold true to what's in the Constitution. And so what we've built is a skeleton or a framework on which the meat and bones and tendons and everything else, sorry, I went too doctory, will be put. But here is the little catchphrase in there that should matter to you. It says that in order for ColoradoCare to be enacted, it has to receive a waiver from the Secretary of Health and Human Services. There are specific requirements to receive a waiver. You need to cover the same number of people. You need to provide at least the same level of benefit. You need to ensure the new plan is affordable for them. And finally, you need to be shown to be actuarially sound or not further increase the federal deficit over the next 10 years. And so if those criteria cannot be met, ColoradoCare does not get established. And yes, you are making an investment up front. It's 0.3% for an individual, 0.6% for the employer. And what that investment will do, in addition to paying startup costs, in addition to paying for the elections, it will also start the fund so that on day one there is money available there to start paying your medical bills immediately. If the system closes down, that's the people's money, it goes back to the people. And the final point I want to make on that is that around this was the whole issue of what happens if there's not enough money. So what I've told you is that we spend $9,523 per person. The Institute of Medicine has shown that we waste 30% of that on things other than providing direct medical care. And so part of what we're counting on here is that the 30% allows us to cover everybody, simplify our process, and align our incentives. There was a great article by Atul Gawande called The Hotspotters, and in it he referenced the Netherlands that really focused on the high-cost medically complex patient. And they went from needing 150 hospitals, they have about 6 million people, to only needing 70. And we're anticipated to going to only need 45. And so if you do medical care right, if you help that 20% that really needs medical care to access the care they need. Now there'll be some people, you can give it to them free, they still won't do it, but those people who are motivated and willing to work with you on health care, you can increase health and you can decrease costs. And so I personally don't think that every other nation has been wrong and that our numbers won't work, but if they don't, there is a safety valve. Vermont is 1/10 of our size. Vermont said, oh, let's give everybody health care. Oops, how do we pay for it? And then they sat down and said, oh my gosh, 40% of our people leave our state for health care. Oh my goodness, all these people should have to pay in, so they're not part of the contribution base. Being from Colorado, I did it the Colorado way. Show me the money, I'll give you the plan. And so I don't think we will suffer Vermont's fate.
All right, now the fun begins. We have questions from the audience. We have way more questions than we have allotted time, so that's a challenge. There have been some requests for Wi-Fi information. I can only assume that's because you want to do some live tweeting out of this room and not checking your email. So the Wi-Fi code is MIUW guest, and the password is volunteer. It looks like all lowercase. So there's questions around price, questions around access, so I'm going to take a few of those. The first question is, how would prices be controlled under ColoradoCare? Senator Aguilar, you've mentioned freestanding ERs and high cost of prescription drugs. How would those be limited?
So if you go to our All Payer Claims database on the Center for Improving Value in Healthcare's website, you will see that one of the huge distortions in our healthcare system is that prices are negotiated based on market power, not based on what does it actually cost to provide this service. In fact, on the website, you'll find some of my talks and you'll see where a total knee replacement in the state of Colorado, a hospital can reimburse anywhere from $20,000 to $50,000. So one way in which prices are controlled is that you actually find out, and Medicare gets this data, what does it really cost to run a hospital as that CEO of a community-based hospital said to me, what would it cost to get me a 4 or 5% operating margin? And then you pay people that price. The other thing is in terms terms of prescriptions, that will be the hardest because it is regulated at the federal level. Pharma, actually if you look at the list of the top 20 CEOs, about 18 of them are pharma, maybe not, maybe 15. And there's a lot of money there. I think there are two options. One is when you apply for the 1115 waiver and it is a separate waiver for Medicaid, or when you apply for the ACA waiver, you apply either for the ability to negotiate prices or the ability to ride the tails of pricing that currently exists for things like community health centers, and that would be our best bet. If that doesn't work, we look at partnering with a pharmacy benefit manager, something like Express Scripts that already has 75 million lives, and getting their pricing and negotiation out.
Great. Cody, your response?
Yeah, it's just interesting, right? Because Senator Aguilar started her last set of comments, her response to my comments, by noting the dramatic increase in Medicaid enrollment, something that I fought for. I lobbied hard on in my last position, and I'm excited to see the growth of Medicaid expansion. I think from my perspective, again, this is Cody Belsley, healthcare advocate, not speaking on behalf of the campaign. I think that the Medicaid expansion is actually a perfect example of where the public-private partnership in healthcare is actually, you know, functioning in a way that makes sense and that it's providing a healthcare safety net. What's interesting though is Senator Aguilar went on to point out that because Medicaid dictates reimbursement rates, many of our Medicaid clients have a difficult time accessing specialty care. I think many of us who are opposed to Amendment 69 are concerned that that problem will only be exacerbated in a situation where the government dictates reimbursement rates for everyone. Will the reimbursement rates be sufficient to keep our specialists in Colorado, particularly in a situation when Colorado is pursuing this policy on its own? What's to say that our best and brightest clinicians, our researchers, those who are developing cutting-edge therapies, our institutions of excellence or centers of excellence, whether that's Children's Hospital of Colorado or National Jewish or Craig Hospital, how will they continue to make investments in their institutions and in their workforce in order to keep the best and brightest clinicians in Colorado and not lose them to other states that will be in a marketplace environment where they can offer those physicians and other healthcare providers and researchers more resources? So I actually am concerned that the price setting, while it may control costs, have very detrimental impacts in terms of access to care, and particularly access to specialty care and access to our best and brightest.
So there's a whole series of questions here on what happens to residents and what happens to providers. Some of you in the audience think that medical or clinicians will leave the state, others think you'll come to the state. Same thing with residents, people coming into the state to receive ColoradoCare benefits and other, particularly businesses leaving. So talk about the fight, flight mentality and thinking around this initiative.
It's funny when you said residents, I thought you meant medical residents. So, you know, in terms of providers, we have put a lot of time, energy, and effort, and actually have a group called Physicians for ColoradoCare, and if you go on our website, you'll see a number of documents about what the benefits of ColoradoCare are to our providers. Let me tell you that the state of your MD providers in Colorado is not good. There is high burnout, there is high turnover, they're frustrated that they can't keep up with the overhead, and for that reason, I think it's something like 75% of people leaving medical training are going to be employed and no longer able to practice on their own. Once you become employed, you have two masters. You have your oath of medicine and you have the person who's paying your paycheck. I had a provider literally say to me the other day, this was in Grand Junction, that I think that if the insurers could provide health care without contracting with me, they would. That's how our medical providers are being treated in our system. And what infuriates me as a primary care provider is that I know that the most expensive piece of medical equipment is a pen in that doctor's hand. And that if you give a provider the time to sit down, to talk to the patient, to make sure they can check on them again the next day, to pay the patient's cousin to come and check on them the next day, that you can achieve much better outcomes at much lower costs. And not only that, the life of the provider is so much more rewarding. You know why no one's going into psychiatry? All you can get paid for is expensive medications. I mean, it has nothing to do with what is the practice of medicine, what did you go into this for. Kelly Ruff the head of Denver Metro Chamber of Commerce told me her daughter visited with a doctor and visited with a PhD psychologist and decided she didn't want to go to medical school because the future was so bleak. So I think that we're going to see providers coming here. Now, the residents question gets asked a lot, and to be honest, I can't find any data. I had a law student intern do research on this. What I can tell you is that we are surrounded by states that did not expand Medicaid. Maybe that's why we have 450,000 instead of 400,000, I don't know. I heard it was marijuana. But anyway, and that in Saskatchewan, when you read reports of what happened in Saskatchewan, you don't hear that a bunch of people from Canada moved to Saskatchewan. And if you look at migration patterns of people, it's usually related to jobs and family. And so while some of it may happen, we have families who moved here just to access medical marijuana for children with epilepsy. Some of it may happen. I think it's one of those many quick fear tactics you could use to get people to vote no. But I just want to add, sorry, that when they come and when they're working, they'll be contributing to the system as well.
So I just want to note, rather than getting into the specifics, because I think Senator Aguilar is right, that it's really difficult to predict the future in a first-of-its-kind system. That this points out these are two more of the unknowns, right? These are two more questions that we can't anticipate the answers to, and that we can't therefore anticipate what the consequences of this change will be. The challenges with provider burnout won't necessarily be solved by this amendment either, though. And I think that's important to note, right? Like, I fully appreciate, and as I said at the beginning, I share many of the goals and frankly also many of the frustrations with the current system. But when voters this fall are not being asked to vote on some abstract concept of whether or not they like the current system. This is not a referendum on the current system. Voters are being asked to approve a very specific proposal and a move to a new system that will have very dramatic impacts for everyone in Colorado. So I urge you to think not just about the theoretical, the concepts, the questions we can't answer, but think practically about the implications of what this means for our healthcare. I would argue that our healthcare system is too important to us as Coloradans to take a risk on something that is so ill-defined, so risky, and so expensive.
Great. So I hope you're caffeinated because we're going to move into some of the dicier questions that have come my way. So this wasn't intended for Cody, but I'm going to ask both of you to respond. Why exactly are the health systems and insurers against ColoradoCare?
So I don't work for them and don't feel that I'm comfortable speaking on their behalf. I would encourage you to reach out to them directly. What I will tell you is I've done a lot of these outreach presentations. I've talked to audiences that include healthcare providers, small businesses, consumer advocates, as well as people who work in the industry today. And I think what I've heard in the context of these presentations and from feedback from people is that while they acknowledge the challenges that proponents have outlined, they have rejected this specific proposal as being the right path forward. They have deep concerns about the unanswered questions. They have deep concerns about the empowering a board of 21 elected people who may or may not know anything about healthcare to be making decisions about their healthcare benefits and what their doctors get paid. They have deep concerns about amending the state's constitution and locking into the constitution such a large and complex system that leads to so many questions. So I can't speak to the reasons Anthem and United and others are involved, but I can tell you that that's what I've heard from all different types of Coloradans. And that's why we see such a broad and diverse group of Republicans, Democrats, Independents, Front Range, rural, people from all different sectors in opposition to Amendment 69.
Great. Senator Aguilar, do you have a few thoughts?
I have a few thoughts I want to start with. I'll give you my politician. There's a boatload of money in healthcare. A $3 trillion industry is at stake. And if we, and when we do this and we are successful, we are going to change that across the United States. And that will definitely result in these 20 people whose salaries range from $47 million to $15 million a year will not be getting those salaries. And if I was making $47 million a year, I would control the system. You know, it's really nice to say that you're worried about the quality of care, but we know that new drugs are invented by scientists funded by the NIH, and then the pharmaceutical company does their clinical trials and breaks up the price to rape us for it, and that many people who need those drugs can't afford to buy them. And then the pharmaceutical company actually lends them the money to buy them so that then the insurance company pays 100% of the cost. There are these ridiculous games going on that are wasting that $3 trillion at the same time that people are dying every day. And so my assertion is that, and I hate to say this, but I think that Bible verse that the love of money is the root of all evil is absolutely true, and that we will continue to see millions of dollars poured into our state. I always say I'm doing a great economic stimulus thing for Colorado. Well, you know, but unfortunately, we actually are going to need some of those millions to combat that. The good news is that I think it was something that they had 60 donors, we had 1,070, and that means how many votes you have, right? And at the end of the day, it's who's going to come out and who's going to vote and who's going to recognize that corporations work for corporations, they don't work for people.
Great. Let's see, there's a series of questions here about providing care to immigrants, to people without documentation. And I think that the large construct is, can you comment a little bit on how ColoradoCare would provide coverage to people who don't have coverage now? And alternatively, Cody, if it's not ColoradoCare, what is it to get access? So perhaps we start there. Or do you want?
I'd be interested in hearing Senator's response.
Okay.
So again, sorry Michelle, I want to put Public Health Institute. They estimate that of the 350,000 remaining uninsured, probably 71,000 are undocumented. I worked for the last 3 interims with Clinic at Tepeyac, and I can certainly tell you the people we saw at Clinic at Tepeyac may have been undocumented, but they were all working. They were cleaning our buildings downtown, they were taking care of your children, they were providing lawn care. And so many of them had illegal Social Security numbers. And I don't know that number, I need to find out from the Colorado Fiscal Institute, but they'll give you an estimate of how much we collect in taxes already from people who are undocumented, who are working under illegal Social Security numbers. And so, so to absorb those people and pay for their medical costs is not a concern. First, the number is small. Secondly, when they get really sick, we pay for their medical care. They show up in our hospital, they show up in our emergency room, we pay for their medical costs. So now we'll just be paying up front to keep them healthy, keep them out of the hospital, keep them out of the emergency room. They're paying into our tax system, and finally, actually, don't tell me when I said this, but it's actually the humane thing to do. And I almost forgot this. You know, if they get a communicable disease, it's your family, your children who are at risk. So we, yes, will be covering the undocumented because it's medically wise, it's fiscally wise, and it's humanitarian.
As the No on ColoradoCare campaign, we are not tasked with providing alternatives. We are tasked with pointing out our concerns about this policy. I will say personally, and stepping aside from my role with the campaign, as I said earlier, I share the goal of reaching universal health care. I think the senator makes very compelling points about the need to solve access to coverage for people who are here in this country working in an undocumented status. But it's not the job of the No campaign to provide the path forward. I frankly think that those of you who are sitting in this room and have been working on these issues for the last 10 or 12 years know the challenges associated with these policy issues and are well positioned to help us move forward an access to care solution that will meet the needs of all Coloradans.
Several questions are about family planning services and using taxpayer money to provide abortion services. Senator Aguilar, can you comment on how ColoradoCare would reconcile that?
I should have anticipated that. So let me start by this. Right now, a lot of the funding that goes to Planned Parenthood pays for access to contraception. And in spite of what the Republican media wants you to think, they actually don't provide, relatively speaking, that many abortions. And the better you do at providing access to free or low-cost contraception, the less abortions are needed. And so ColoradoCare will automatically remove that responsibility from Planned Parenthood because all women will have access to all forms of contraception at no cost because contraception has been determined to be a preventative service that says prevention is at no cost. And so those few women who do still need abortions, our attorney gave me a wonky thing that says there's a way to do it because this, in some instances, is a federal waiver and it preempts state action or something along those lines. And I could look for that, email it to Michelle if you'd like, or someone for you to have access to his legalese response. My personal response is the number will be small, and now when you donate to Planned Parenthood, it can go toward that.
So I've also spent some time with lawyers looking at this question. Colorado has a constitutional amendment, in fact, prohibiting the use of public dollars for abortion services, except in the case of when it endangers the life of the mother. Amendment 69, as a second constitutional amendment, is silent on the question of whether or not, of how this new provision will impact, it's Article 550 maybe, the existing constitutional amendment. As a result, the lawyers that I've worked with have said that ColoradoCare will only be able to finance abortions in the case of the pregnancy, continuing the pregnancy endangers the life of the pregnant woman. So for those of us who care deeply about access to abortion services and reproductive health services for women, this is a deep concern. It is a loss of benefit for women who have private coverage today through their insurance plan for abortion services regardless of circumstance.
Several questions about rural issues, particularly since there's so many counties here that are considered rural or frontier, 47 out of 64. What is ColoradoCare going to look like in rural communities?
Thank you. So one of the things I hear from the opposition is that there will be winners and there will be losers, and I will tell you that our rural communities will be the winners. Our rural communities in the Summit County area have the 4th highest rates in the entire country for health insurance. And I assert that's because they have one hospital, they have 1 or 2 specialists, and they can be charged whatever they need to be charged. And the other thing is that our rural hospitals are the ones who really need, along with Denver Health, when I'm on their board, but really need the hospital provider fee because they don't get the kind of income the Front Range gets. And so one of the duties of ColoradoCare is to devise payment mechanisms necessary to ensure that there's an adequate supply of providers in the rural communities. And secondly, what I would envision, some of you are probably thinking, oh God, we go from 150 hospitals to 70, but we have enough hospitals. Is that one of the duties of ColoradoCare will be to ensure that they backfill and actually pay for certain hospitals to be open based on need, not on profit.
So I just want to note that this is how the senator envisions this playing out. And I think Senator Aguilar has great intentions and good vision, good intended vision. But the decisions about this are left to a 21-member elected board. A set of elections that could be easily politicized. You look at the money that has come in from out of state to influence our school board elections in Colorado over the last 10 years. This 21-member board is going to be empowered to manage a $38 billion budget and make critically important decisions. You've got to believe that those elections are going to become the focus of people on both ends of the political spectrum who are interested in advancing their ideology. I don't have confidence that despite the good intentions of the proponents, that board is going to be able to solve the workforce challenges, to solve the access to healthcare challenges that we already face in Colorado's rural communities and that we haven't been able to solve collaboratively over the last 15 years. I want to come back to the point that this is not an abstract concept that we're voting on. This is a very specific proposal. And so you're being asked to consider whether the vision outlined here with the lack of details is enough to go on to trade out a system that is already in place, that is already employing people, that is already providing healthcare services in underserved communities today. I'd argue it's a risk not worth taking with something as important as our healthcare.
I just want to direct you to page 7, section 6, lines 7 and 8 of the amendment, where it specifically says, ColoradoCare may provide funding and other support to improve access to health care services for all beneficiaries regardless of where they live in Colorado. And ColoradoCare may provide funding and other support for statewide access to emergency and trauma care services. And so this is anticipated, and I do want to point out that the 21 members that you elect are a board of directors. They are not the CEO, CMO, CFO, and hopefully we'll have the intelligence to hire people to run this medical company. And there'll be a lot of maybe unemployed people from the health insurance industry they could bring in.
So can I just respond real quickly, as long as we're going through the language, there are a lot of mays in there. And for those of us who've spent time at the Capitol, we know there's a critical difference between a may and a shall. Right? I mean, these are details. I appreciate, again, the intentions are well laid out here, but there's no assurance that this is going to practically be played out in the way that the proponents envision. And the question to voters is that a risk you're willing to take with your health care?
There are several comments and concerns about mental health, and particularly mental health parity, and especially the integration of fairly comprehensive Medicaid mental health benefits into ColoradoCare. Can you talk a little bit about mental health and how it's conceptualized in ColoradoCare, and more globally, when there's a set of benefits that are offered through Medicaid that are comprehensive, and how do you reconcile those, or how would they be reconciled?
So the amendment language is very clear on the point that Medicaid beneficiaries will continue to retain their Medicaid benefits. As the Senator outlined, no waiver would be approved by the federal government to give Medicaid beneficiaries less than the Medicaid benefits that they're provided today. So I think that answers the Medicaid question. I think the mental health question in terms of benefits gets to a broader question, though, about benefits. As long as we're going to the amendment, for those of you who have it in front of you, page 6, section 6, outlines 11 lines of the categories of coverage. And they're broad: ambulatory patient services, hospitalization, prescription drugs and DME, mental health, emergency care, preventive. These are not, if you compare this list of 11 to the insurance contract that you have today that outlines your specific benefits and how many visits you get and what your copays are, et cetera, there's a lot less detail provided here and a lot less assurance of what your benefits are going to be. As a result, it makes it impossible for Colorado voters to compare what they're getting today under their private health insurance or their Medicaid coverage with what they may or may not be able to be provided under ColoradoCare, and impossible to compare the cost to determine the value of that health care dollar. So I point that out. I think the other thing that I'll just point out, because I think it's interesting, having spent a lot of time working on pediatric healthcare issues, number 8 in the list is pediatric services, including oral, vision, and hearing care. As a kids' health advocate, I love to see that pediatrics are called out. It's interesting to me, though, that oral, vision, and hearing care are only called out in the context of pediatric coverage. There is a line at the end that says the board may authorize payments for benefits not specified here. So perhaps it was just, perhaps the intention is that the board will go back and provide oral, vision, and hearing care. But for people who care about integrated whole body healthcare services, I think it's surprising to see oral, vision, and hearing specifically called out for a pediatric population and not provided for in other adult populations.
Thank you. So first of all, I want to go back to the fact that in order for the ColoradoCare to move forward, they have to receive the waiver from the Secretary of Health and Human Services. And so the rationale behind those 11 categories listed on page 6 is that those are categories of the Essential Health Benefits Plan. And so what we listed there was from the Essential Health Benefits Plan, understanding that when again, this is a 10-page amendment, if you take out the introductions and the 2-line, 12th page, that when the waiver is applied, all that is specified and spelled out, and if it does not meet the requirement of the waiver, which is to provide at least the same level of benefits, meaning at least what you are promised from your insurance right now, I won't say it's what you get from your insurance right now, that the waiver would not be granted. But I do want to talk about mental health care because I want to tell you an interesting story. So Denver Health received one of the Medicare grants to look at high-cost patients and how they could manage the care of high-cost patients. And in the course of doing this, what they found out was the majority of the patients who were high-cost had coexisting mental health problems. They either had a psychiatric disorder or a substance abuse disorder. And so if the focus of ColoradoCare is to provide cost controls, you need to focus on mental health. And I think that, interestingly, the evolution of our healthcare system, when we made mental health a secondary sister and then dropped it for many insurance plans, may have contributed to why our costs are so high, because we're not dealing with the whole person. And I appreciate your statement, you're absolutely correct. Our intention is to cover oral, vision, and hearing care, but we didn't want to put more into the Constitution than we had to. And so again, we have this dichotomy of why to put in the Constitution, well, we want to ensure a baseline, but there are not enough details. Well, that's what the statute will do to ensure that the legislature does it. And part of that is because how we provide medical care today is very different from how we provided it 20 years ago, and it's probably very different from how we will provide it in 20 more years. And so today, the nice thing is that while we may not get a provider to move out to Lyman, Colorado, we can put a computer there and at least get telemedicine, or potentially pay for someone to fly there for a day. So, there are a lot of things that are possible, and you couldn't put that level of detail without being a much too big of a category. But tying together that these are the essential health benefits that are required, and that they're tied to getting the approval of the waiver.
I'm going to round off this morning's discussion with a few more theoretical and cerebral questions. The first one is Amendment 69 a judgment that the ACA has somehow failed? Whoever would like to.
T.R. Reid, I got mad at him because he said, this lets us get rid of Obamacare. And I said to him, we're both spokespeople, we should be sharing the same message. And here's what I see. This is possible because of Obamacare. The Affordable Care Act allowed Colorado to expand Medicaid, and I actually got to carry that bill. The Affordable Care Act allowed us to create our own exchange. It gave us the ability to try a healthcare cooperative that didn't work. And then separately, or maybe related, I don't know, I'm embarrassed to say, but we have our state integration model going on well as now. And so I would in no way say that this is saying the ACA has failed. This is saying that, and I'll tell you this story as well. I in 2008, you'll be shocked to hear I was an Obama supporter. And when he was looking at healthcare reform, I was so angry when I read those things about how single payers are on the table. I'm not even talking about it. And then when I read the Affordable Care Act, I said to myself, we are going to have mandated underinsurance. I was saying this in 2010 when I read this. And I was so angry and disappointed in President Obama. I entered the legislature in January of 2011 and had trouble getting the Democratic caucus to support me introducing a bill to create a single-payer healthcare system, even though that was on the party platform of the Colorado Democratic Party. And so I said, my God, President Obama has performed a miracle. And the miracle that he performed, and the little piece in there he put in specifically for me, or at least for Colorado, is Section 1332, which allows in 2017 for states to be the laboratories of invention. And what I think happened was the ACA was the best they could get from Congress. I don't remember, but I think there were no Republicans that voted for it. It's been voted against 60 times. It made it all the way to the president, and he vetoed once the repeal of the ACA. And so in no way do I diminish the value of the Affordable Care Act to the United States of America, to Colorado, and to ColoradoCare.
So another place where the senator and I agree is the value of the Affordable Care Act. I think what's true is that the Affordable Care Act is still pretty new. I know for those of us who have been deep in the weeds, we have a lot of traumatic stress associated with the passage of it and its early implementation, but it is still fairly new. We're just starting to see the impacts of the Medicaid expansion. We're just starting to see initiatives like SIM get off the ground. We're just starting to work on payment reform. Governor Hickenlooper, when asked about Amendment 69, said it's too soon to judge the outcome of healthcare reform, that we shouldn't trade in the path of reform that is working in favor of a system that is totally untested, totally risky, and full of so many unanswered questions. Our new reforms are just beginning to bear fruit. And so I think we have a choice in front of us, which is to say, do we continue on the path that's working, the path that is showing slow but steady change? Or do we scrap that in favor of an initiative that is full of a lot of unanswered questions and could have very significant impacts, not just to our healthcare system, but to our economy, and to our population, and to the quality of life that we have in Colorado?
I just want to say that having sat at the political table for 6 years now, I say we junk it, we just take it over as a people's revolution. And I'm pleased to lead that.
I'm going to ask my final question. Cody and the Senator will be around for a few minutes afterwards if we didn't get to your question today. I'd like you to comment a little bit on when voters go to the polls or get their ballots in the mail. Was this going to be a hearts vote or a minds vote on this issue? And I would also like you to predict the outcome.
That's interesting. You know, I think for a lot of people, myself included, healthcare is a head and a heart issue, right? I'm the mom of 2 young kids. I'm parenting an older and aging father who just this week had to go through surgery in a different state. And I think that at the end of the day, the people that we love, we want to be healthy. We want them to thrive. We want them to be successful. And I think there is certainly real frustration in America about the limitations of our healthcare system. And as I've said before, and I'll say again, I think those frustrations are valid and they're real. But we have a system that is providing health insurance to 94% of Coloradans. We have a healthcare system that provides high quality, good paying jobs to a significant portion of our workforce. We have a healthcare system that is not perfect, but is meeting the needs of most Coloradans. And what we are being asked to do is to scrap a system that, again, is not perfect, but is meeting the needs of most Coloradans in favor of something that is entirely untested and, frankly, very, very expensive. And we could very well end up in a situation where we're paying more for less. And that's an outcome that I think would hurt us both in our heart and in our head. And I've, after this political primary season, I've given up on prognosticating. So I'm going to say that I don't make predictions, but that I promise that the No on Amendment 69 campaign will be here, will be active, and will be out and about around the state. I'm trying to build a big tent opposition, not because we oppose the good intentions or the values behind Amendment 69, but because we have deep and very real concerns about the policy of the specifics in this proposal or the lack thereof. And if you're interested in joining us, we would welcome your support.
Senator, last word to you. I'm embarrassed that I forgot your question. I got distracted by your answer.
Hearts and minds.
Okay.
And outcome.
So, hearts or minds, you know, I think that a lot of it will be hearts. I personally am heartened to see that some people in our opposition have polling that say, even reading the question, 40% of people would vote to check our current healthcare system. That makes me very optimistic that we will pass by 51%, which is what the polling indicated after the opposition had talked to them, we could pass by. And I think that the reason is that we are not stupid. The movement of the 99%, the corporations, what Donald Trump has done, what
what Bernie Sanders has activated in terms of the millennials and the young vote. We know that money trumps good policy in the United States of America in 2016. And I'm almost crying saying that because it's really hard to be at that Capitol and see people who I thought had my same values vote against them because they're afraid about staying in power. And so I am hoping that people will realize that, yes, this is an experiment, but you are going to be screwed by our current system. And in 2010, I predicted mandated underinsurance. In 2016, what I'm predicting for you is that only the rich will get the very expensive treatments. And so I think it's worth a try.
And with that, I thank all of you for participating today. And Adela, any closing thoughts?
Yeah, I did want to thank all of our speakers very much. This was a wonderful experience. It was very informative, and I hope for those of you who are undecided, it gave you the information that you need to be able to make a decision, or at least know where to go for additional answers. I didn't say that CCHI as an organization does not yet have a position on Amendment 69, and we will be working on that over the course of the summer with our policy committee and our board of directors. And so we'll look forward to further studying all the information and taking today's comments into account. I also wanted to recognize, because I failed to do so, that we do have one of our board members in the audience, Chris Trigler. So it's always great to have board representation here at our events. So I think all of our speakers are here for a few more minutes if you wanted to try and grab a little bit of their time. I appreciate all of you coming, and whether it's a heart vote or a mind vote, I know you'll make the right decision for you. Thank you.